Yes, you're welcome back. This is still Sunup on Shobiz TV with me, Evergreen Asantua, and this is our well-being segment. Yes, so today we are talking about infertility in men and women. And we have been joined in the studios by Mrs. Laura Ajoko Abubakari, and she is a midwifery officer. You're welcome.
Thank you, Madam.
You're looking very good.
You're also looking splendid.
Thank you so much. Yes, and on that note, a special thank you to Glam by Aseye for always giving me the flawless beat, and also to Goldilocks for giving me this beautiful outfit. You can find them on all social media platforms at Goldilocks GH and also Glam by Aseye. And I mentioned today we are talking about infertility in men and women. Mrs. Laura.
Yes, ma'am.
It's a fresh week,
sure.
And a Monday morning, as a matter of fact. This is quite a huge topic.
Yeah.
And something that makes a lot of people cry, something that separates families.
Sure.
Something that, brings people down.
Sure.
This is like a big deal.
In fact, I would say it's more like a challenge.
Yes.
To most couples.
I agree with that.
And the challenge goes to a long extent of even bringing up separations in marriage, like you said. Because you're not giving birth, what is the problem? Right. Themselves. Or of their own, that will call their own.
Their own.
And if there are nothing like that sort happening, it's worrisome.
It's worrisome, yes. So, Mrs. Laura, what is infertility?
Oh, okay. I'll say that infertility is actually not being able to conceive within a period of, let's say, 6 to 12 months or above after having unprotected sex.
Okay.
Several unprotected sex. And nothing is happening. Then it gives you a little worry. That what is the problem? Okay. Because after having sex, there should be fertilization. Because the sperm will have to thrive all the way to meet the egg. So if nothing is happening, is it a problem with the man or is it a problem with the woman?
So that having unprotected sex with someone without conceiving. So what we are trying to define here is the fact that when you are intentional about it and you want to conceive,
sure,
but then again you are not able to conceive. That is infertility.
Sure, over a long period of time. So let's say you are having sex, continuous sex, let's say 3 times in a week for a period of 6 months, nothing is happening. It prolongs to, let's say, 1 year, nothing is happening. Unprotected sex. At least when you are having sex, you should get pregnant. And if you are not having sex, you are not going to get pregnant. But you are having sex continuously unprotected. And when you are having it unprotected, so far as it's unprotected, you don't have any other external things, barriers to prevent you from getting pregnant. Like, let me say, family planning, you should be able to conceive. So if you are not conceiving, meaning that there is a problem.
There's a problem.
Which needs to be
attended to. And what causes that problem? What causes infertility?
Actually, there are so many causes of infertility.
Right.
So looking at the female side, it could be problems with your ovulations. That's where the eggs are being released. Or when you start realizing that you have irregular menses, or you're having, your menses are irregular with women. And then when they have problems with their fallopian tubes, when they have problems with the uterus itself, sometimes some people have fibroids and other things that makes them unable to be able to get pregnant or to conceive. So normally, some of these things affect women, the women's side. And when we go to the men's side, it could be your sperm. Either the sperm is not strong enough to impregnate or to fertilize the egg, or the sperm is not having the right shape, or let me put it this way, that you don't have a quality sperm that can be able to fertilize the egg that we call the ovum. Then that can also be another problem why you are not able to fertilize an egg. And then with the men too, if you have problems with ejaculation, you can also have challenges being able to fertilize an egg through your sperm.
It means that is a lot of causes right there.
Sure.
So it will not be just one particular cause. It will be a lot of causes.
Actually, depending on the individual and the cause is either one or it could be two for one person. It could be one for one person. If your ovaries are not producing the egg that can be able to be that will be able to be fertilized, it can be a problem. The same way, if a man is not able to produce quality sperm, he too can also have that challenge. So depending on what is causing the problem, then we are able to attend to that.
Okay, so I think then it means that it is high time that we actually let go of the women. You know, usually when it happens, we are focused on the women more than the men. We forget that the men also have causes that can cause that.
You know,
why
in the Ghanaian society, everything that is a problematic thing comes with women. That is what we have made the Ghanaian society looks like. But when you look at fertility, it can be either 1/3 of the woman, 1/3 of the man, or 1/3 of any external factor. It can be stress. So there are so many things that can cause one not to be able to be fertile or to be able to conceive. So it's either 1/3 coming from the woman's side, so 1/3 coming from the man's side. So the men should stop giving us tag that if you are not giving me children, then you are the cause.
Right.
It's necessary for you to go ahead to do other investigations to know whether I am the cause or you are the cause, or there is any external thing that is causing it.
Okay.
Yeah.
So it also means that when it happens like that, there is no way you'll be able to tell unless the baby is not coming.
Sure. So far as there is no pregnancy occurring, meaning that there is a problem. Like I've given the duration. So pregnancy is not occurring within 6 months to 1 year. You are having regular unprotected sex as couples. And I expect that having regular unprotected sexual intercourse should make you, the woman, conceive, or should make the man be able to impregnate her wife. But if this is not happening, meaning that there is a problem.
There is a problem. So when we take a man and a woman, which of the genders actually gets more of this infertility?
Okay, I would say that mostly comes from the women.
The women.
But the men too are also the same way. It is 50-50. It's either the woman or it's the man. But mostly we find it with women. Because women have so many challenges. It's either with your menses, it's either with ovulation, it's either your tubes are blocked, it's either you have fibroid, or it's either you have PID, pelvic inflammatory disease, which can also make you prone to infertility. There are so many conditions that women face that makes them pre-exposed to some of these problems. Your age can be a factor, and as you age, everything is aging. Like the last time I said, everything is aging, and the strength at which some of these organs are able to work or produce, let me say, the ovum, or the strength at which the fallopian tube should be able to have a good state to be able to move the ovum through its, or for it to roll to come to the junction where fertilization will occur. It takes a long time, and then it needs a strong let me say system to be able to adapt to some of these things. So this is what I would like to say about it.
Okay, now let's also take the men. What actually causes, let's look at the causes when it comes to men.
Okay.
Because this is like this morning, we have to stop blaming the women.
Sure.
Yes. So let's take a critical look at the men.
Okay, coming to our men, I would say that they normally have problems with quality semen, or let me say sperm.
Right.
So it's either the sperm is not quality, it could be light or watery. It's either the sperm is not the sperm itself. We have the polar head and the non-polar tail. So the shape of the head should be oval. So if you are not getting a good shape of your sperm, can also be a challenge. It's the normal shape of the sperm should be oval with a very long tail. So let's say a sperm having a very short tail. If we are running, I have a long tail, I can run fast, I can be able to move fast, and you have a short tail, you might have challenges to be able to wallow and be able to get to the point at which you are supposed to fertilize the egg. So let's say if we have challenges with the sperm itself, can be a problem, because if the sperm is not having a good shape, is not having good quality, cannot be able to move. The sperm, they move, they run. So they look at the strength at which you are able to move to be able to fertilize the egg. So if all of these things makes your sperm quality, so if some of these things are problematic, it have challenges with our men. And then men who have problems with ejaculation can also have that challenge. So if you are not able to ejaculate well, or you have any other condition that may hinder the tubes being open, you know, when as they grow, those who have problems with their tubes, and it also blocks the tubes. And if you have such tube block, the sperm cannot be able to penetrate to be able to get to the egg, even to be able to ejaculate before getting to the egg. So some of these things are the things that normally affect our men.
Okay, but with the improper ejaculation thing, is it I don't know how to even ask this question. Is it that the how am I supposed to say it?
So as and when the men have sex, they are supposed to ejaculate. So if the person naturally have a problem with ejaculation, it won't be able to, the sperm will not be able to climb up to be able to come out. Are you getting it? Yes. So it will not be able to climb up to come out to be able to move into the, let me say, the vagina and cross all over and wallow, swim all over to the uterus. That is the problem with the men. So if you have challenge with ejaculation, you can have problems with fertility.
Okay, now let's look at the differences. What is the difference between infertility in men and then women?
So actually, fertility in men comes with their problems with the sperm or problems with ejaculation. And then with that of the women is problems related to our organs. Let me say the reproductive organ. That is the ovaries, the fallopian tubes, coming down to the uterus. When you have challenges with all these areas, there is a possibility of you not getting pregnant, and that can be a challenge. So this, I'll say, will be the difference between infertility between a man and that of a woman.
But other than that, there are no other differences between them.
Differences as in what makes a man infertile
and what makes a woman.
Actually, there are causes of infertility. Like I would say, stress can make somebody infertile. Your body weight. So like those who are obese, it can also be another factor. So there are factors that are involved that makes man or woman infertile. But for the differences, mostly they are, the only difference will be the man's sperm and then the, let me say, the woman's ovary. We have ovary, the man has sperm. So is the sperm going to fertilize the ovary? So if you have challenge with your sperm, the possibility of you not being able to fertilize the egg is high. If you have challenge with your ovaries, the possibility of the sperm coming to fertilize you is also high.
Now let's talk about the women, their eggs. What makes an egg quality?
Actually, the production of the egg being quality is when it's able to be fertilized. So a quality egg is able to withstand all pressures and be able to being fertilized by a sperm. So if you are able to fertilize the sperm is able to fertilize an egg, I'll say it is a quality ovum.
Okay.
That's how I'll describe a quality ovum. Because if the ovum production, we have where the ovaries are, they are at the external parts of the tubes. So they are over there, and the production it changes every month. So every month there is production of ovule. So after your menses, we call something ovulation. You have to ovulate. And during the ovulation time, an egg is released. So when the egg is released, the state of the egg, it should be very round. It should be in a good state, which can be able to undergo fertilization. So if it's not in a good state to be able to undergo fertilization, then I would say it's not a quality egg. So it's an egg that can easily be washed off.
And since we spoke about the factors, I think we should elaborate more on the factors.
Sure.
As well.
Okay, so some of the factors that can make one infertile, like I said earlier, we can have problems with ovulations. So maybe you are not ovulating, or you are ovulating but nothing is happening. It's a problem. So if you have problems with your menses, you have to take a second look at it. Aside that, we have overweight people or obese people. They are also at risk. So you have to have a normal body weight. And then when we look at, let me say, the age of the woman and the man, from 35 upwards, you are at higher risk of being infertile, because around that stage we call them at risk mothers. The same way, if you're a man around your 40 upwards, by then you should already start producing. So if you are not producing, you can have challenges with either your sperm or challenges with your tubes or any other factors involved that may affect your possibility of fertilizing an egg. Then aside that, our lifestyle, stress can be a problem. People who normally take alcohol, they can be at higher risk of having infertility. Those who smoke are also at higher risk of having infertility. Aside that, if you have any medical condition, that can also be a factor that will cause one to be infertile, is also another way we can say that can make you prone to having infertility.
And now that you spoke about the age being a factor, why are women who are 35 years and above at risk?
So like I said earlier, around that age, we are expecting that around your 20s, you should start delivering. So from 25 years, you should start getting pregnant, so that the uterus also has a way of working. It's like you giving me work to do. If you're not giving me work to do, I become empty. And around that stage, fibroid or other conditions can set in. Now, if you're not getting pregnant at the early stage and you get to that advanced age, there are so many factors around that age that may make you prone to being infertile. And you know, the eggs are being released from stage to stage. I've started releasing eggs from, let's say, age 12 years, 13, up down to 35. So around that stage, you can see the number of work that part have been able to endure. So as and when you age, the production of this egg too reduces. So that is why when the women get to age 35 onwards, it's liable that you can even get to your menopause stage. And around the menopause stage, there will be no ovulation. Sometimes you can ovulate, but the ovum that comes is not strong enough or quality enough to be able to be fertilized. So you have them, you have those mothers not getting pregnant, and it's also worrisome. Miscarriage too can also, women who get miscarriages, they are also prone at having infertility, because there could be something that is causing the miscarriage. It's either the egg is not quality, like we said, to be able to endure pregnancy. So immediately it comes out.
Right.
And that is it.
But why is it that when it comes to age, it looks like all the time men, they go scot-free?
Men don't go scot-free. I would say that if a man has challenges with ejaculation or challenges with his sperm production, or he's producing the sperm but it's not quality, he also can have problems with fertility. So it's not only that our men are being spared. Men are not liable to most of these conditions, but you get one, let me say 2 out of 3 to be having such problems. And then around their ages, men, their reproductive system is different from that of the women. and they mostly endure most of these things than we the women. And then with men too, it also happens within 35 onwards. If you the man, you are not being able to produce a child, and you are having unprotected sex, it should give you a worry. It's not only the woman, so don't think about our women alone. Think about yourself too. That why am I not being able to impregnate my wife?
Right.
So there is a problem, there is a challenge. So our men shouldn't say that they are not at risk. They are also at risk. So it's one way or the other.
And earlier you also spoke about stress. So I want to know the exact role that our lifestyle choices play when it comes to infertility in both genders.
So one thing about stress is that it affects the whole body. It starts with the mind. So before you want to conceive, everything starts from the mind. Oh, I've made up my mind that I want to get pregnant. So already the mind will have to prepare for pregnancy to occur. Now you have stressed up yourself. Immediately you start thinking about that, already you are putting a little pressure on the brain. But one thing about fertility, I would say, is that when trying to conceive, free your mind. Have a free mind and prepare yourself that, oh, I want to now take in. So far as you have a free mind, you are having your normal daily work, daily activity, it makes you a little relieved. But the problem comes when they start having challenges of conceiving, where the woman will have unprotected sex over a long period of time, pregnancy is not setting in, then you become worried. What is happening? What is happening to me? Why am I not getting pregnant? It becomes stress upon the body. And then that alone can even cause the fertility this thing to prolong, or the infertility to prolong, because already you've stressed up the body. And the time that you put stress upon the body, then the body is an imbalanced state. And when you are in an imbalanced state, nothing will happen when you expect it to happen.
So does that have to do with the hormonal imbalances? Talking about
we have hormonal imbalances too, but with the stress, it deals with your work, the activities, your stress,
your diet,
exercise. So many things are factors that put stress on the individual.
Okay, now that you've mentioned hormonal imbalances, let's also look at that. What does also our hormonal imbalances has to do with infertility?
So there are hormones that helps us with the men and the women. So there are hormones that are helping us to be able to either produce egg or produce sperm. So we have something we call the anterior pituitary gland. It's inside the brain cell. So this anterior pituitary gland has something that it releases. We have the follicle stimulating hormones, and we have estrogen, and then we have progesterone for the men. So if these hormones are being released but not at the right quantity, it's imbalanced. So it's either they are producing but producing less, or it's either they are producing or producing more. When it's producing more, it's even good, because that is why we even give them, for the treatment of fertility, they give them some medicine we call the chlorophyll, that helps to build their hormones and to increase the hormone production. So this one helps the hormones to increase its production, to be able to get to or produce more eggs, to be able to be fertilized by the sperm. And then the same way with the men, the progesterone will also increase and then cause more sperm production to be able to fertilize the woman's egg, or let me call it the ovum.
Okay. Now I also want us to look at our environment. Are there environmental factors that also contribute to infertility?
Yeah, there are external factors. So when you are exposed to radiations, it can also make you prone to having infertility. So taking X-rays, sometimes you see when you get there, they have protective organs, protective gadgets that they put on. So if somebody working in such an environment can be high or prone to having infertility, especially those who work with the X-rays. So exposure to radiations can make you prone to having infertility. And some of these external factors too can be you smoking or having excessive alcohol intake, or the environment in which you live can also put pressure on you. That's where the stresses comes, especially when you are not giving birth and assuming you are with your in-laws, then they will start putting pressures on you. So the environment itself will make you either have more problems with fertility, because already the mind is disturbed, and you having external people also giving you more troubles. Why are you not getting pregnant? We need our baby. Why are you not getting pregnant? Is a lot of worries for our women. And when we look at all these factors that are in our environment, can also be another cause why people don't get fertile or are being infertile.
We know that when it comes to sickness or diseases, there are a lot of them that are associated with genetics and heredity. Is it the same with infertility?
Let me say that with infertility, I would say it doesn't come with heredity. Okay. It comes with the hormones or the production of the egg. So there are some people who have challenges with their menses. Sometimes it's genetic, because I would say that you have a woman being infertile, and it crosses along to the other siblings, or let me say the other children who are given or who are born in subsequent years. But that one will come with maybe, let me say, menstrual cycle, or they having challenges with their ovulation, but it can be corrected. So far as we have treatments and medications that are given to help them overcome some of these challenges. If you have problems with your tubes, we can do some surgeries for you. Some procedures can be done to help you have free movement. I feel some of these things can be corrected.
Okay, but we've talked about a lot of causes. We've talked about factors as well. But what are the common factors or even causes of infertility? The common one, those ones that you as a midwifery officer, you know that it is common when it comes to women, so that our viewers watching will also take notes when they're experiencing anything like that. They will know that it is related to that.
So I'll say the common one is when you have problems with ovulation. So it's either you are not ovulating, or you have challenges with ovulation. Or when you have problems with your menses, because ovulation subsequently will end up with menstruation. So if you are not ovulating or you are not menstruating, what is causing it? Is it that my eggs are not being produced? Because if there is no egg, there is no blood. So if the eggs are not being produced, there's not going to be menstruation. So if you have challenges with ovulation, you have challenges with your menstrual cycle, you have to go and see the specialist so that we find out what is causing it. Is it that you are not producing the eggs, or is it that the eggs are being produced but they are not strong enough or quality to be able to come out as menses? Or is it that you are menstruating, you are having irregular menses period, or whatever your problem is? We find out for some of these things and know whether the woman is good to go.
Miss Laura, you've actually said a lot, but the big question is, can it be cured?
Actually, I would say no, but it can be managed, or it can be corrected. So you being infertile doesn't mean that you can't have a child. You can have a child when it's being corrected. So we can correct it with either medications, we can correct it with either your personal lifestyle. Maybe you are not having the sex at the right time. So when you are ovulating, you know that after my menses, within the next 7 to 14 days, ovulation will start. So around that time is a time that you should be having unprotected sexual intercourse. But if you are not timing your sex also well, can make you infertile, because maybe you'll be having the sex at the wrong time. The time that you have your free period is when you're having your sex. It will fertilization will not occur. So lifestyle or time will also be another factor where you should also look at that. Then we have the medication, we have correction of conceptions also can also be another thing that can be done to help them to be able to resolve some of this thing. the correction of the conception, we can have the in vitro fertilization, or we can have the intrauterine insemination.
Okay, there is a Facebook comment, so I want to read that.
Okay.
But while I try, okay, let me find it. Okay, while the message is loading, maybe we can continue. When I get the message, then I can read what people are actually also saying. But then you spoke about sperms, it being weak, it not being thick enough, it being light, watery, and so many other things. So how can one take in his sperms?
How can one take in the sperms?
The thickness of the sperms.
Actually, the normal sperm is whitish gray in color and is jelly-like. So you taking your sperm, you can do, it depends on, if you are a couple, we can encourage you to have sex. When you are about to ejaculate, you bring out your penis, and then you can take the sperm as a sample. Or if you are not married, normally they will tell you, the gynae specialists can tell you to try to masturbate to be able to take your sperm. But the normal sperm is what I've just described, how it looks like. And it shouldn't be watery. It's a little thick, and then it's whitish gray, and then it's jelly-like. So you could feel the gel in it when you want to feel the consistency of the sperm. And then the sperm itself has the polar head, a head which is oval, and then the non-polar tail, which is very long, and I mean very long. So if you have a very short tail, meaning that you have a challenge. If the head too have a shape which is not oval, meaning that your sperm is not that at the good shape, which can be able to fertilize the egg. They are able to fertilize the egg though, but sometimes you should have the normal sperm shape or size.
But with all what you are describing, how will you even be able to tell?
It's a microscopic test which is done.
I see.
You can't see it with your eyes. So the sperm just comes out as sperm, like thick, jelly-like. But for you to be able to see the actual sperm, it's normally when you take the sample, they wash it, and then they go for microscopic testing. So that is where you see the shape that I'm describing. So without the microscope, you can't see the sperm, like the shape of the oval head with a very long non-polar tail.
But we always say that masturbation is not good. But you said sometimes even your healthcare provider will allow you to masturbate.
So that is somebody who is not married.
Who is not, okay.
And we want to test the sperm.
The sperm.
We wanted to know the sperm count.
Okay.
So one way or the other, we need to get the sperm. So how do we get the sperm? If there is no woman available for him, then he have to do the masturbation so that the sample can be taken for the testing. For the sperm counts, to know if the sperm counts are enough to be able to fertilize an egg, or they are strong enough to be able to also move. We call it motility. They move in the way like that, swim all over up to the ovum, the uterus.
Okay. So it means that no matter what happens, no matter the case, even if you, the female, you are fertile and your boyfriend or husband or your partner is infertile, there is no way there can be pregnancy. So
when your husband is infertile, pregnancy cannot occur. The same way when the woman also have challenges, pregnancy will not occur. So it's one way or the other. It's 50-50. So if your husband is infertile, there is no way pregnancy can occur. And when pregnancy is not occurring, meaning that infertility is around yeah.
Okay, so now I have the Facebook comment, and this one is coming from DJ Ketekre from Sankor Infantim. I'm wondering where that is. It says DJ Ketekre from Sankor Infantim. Please today I hope you are doing a great job. Please keep it up. Okay, that is the exact word. So
thank you so much.
Thank you so much, DJ Kitikwe, and we appreciate wherever you are viewing us from, which is Sanko in Phantom. Maybe next time you can let us know if it's in the eastern, western, or something, so that we'll know. But we appreciate you and your message as well. But Mrs. Laura,
yes, ma'am.
Let's look at the coping mechanism and the psychological impact that it has on an individual, because even before we actually started delving into the topic, I made mention that this is something that separates people, this is something that brings division, this is something that drains people, both mentally, emotionally, physically, psychologically, everything. So what are some of the psychological impacts that it brings on individuals, and what are some of the coping mechanisms?
So with the psychological impact, I think I've mentioned it earlier, that everything starts with the mind.
The mind.
You even talking to me about my pregnancy, I already have problem with it. And it is something that is worrying me.
That is worrying you.
So coming forward to tell me that, why are you not getting pregnant, is even more worrisome. And it puts pressure on the brain cells. So far as there is pressure on the brain cells, the body is an imbalanced state, meaning that you are even putting more pressure on the individual. Especially, it comes from our in-laws. So where the in-laws will see you not getting pregnant. Hey, you got married last 2 years. Why are you not getting pregnant? Already, the person herself is stressed and traumatized with what she's undergoing. And you are going to put more pressure on them. And putting pressure on them makes them imbalanced. Already when you put stress on the body is an imbalanced state and causing more harm to the individuals. So would advise that the pressures coming from the outside, that is the environment, should be curtailed. Apart from that, the husbands should also help their wives, if it's the problem with the wife, help her to come out of her stresses. So giving her more love, showing her more compassion, telling her everything will be okay, at least helps them to be able to be relieved and make them psychologically sound, to be able to have that good environment, to even have more sex, that will help her to be able to conceive. Aside that, help her out, go and see the gynecologist. All these things psychologically helps them relieve stress. And it makes all stresses down. And it helps the woman to be able to stand on herself and know that, no, there is still an assurance of what she getting fertile or she conceiving in the future.
Okay. And I just realized that we have never, or you haven't mentioned anything related to STDs. Meanwhile, it happens through, penetration. It's a sexual intercourse something. Does that mean that sexually transmitted diseases has nothing to do with infertility?
It has. So if a man has had gonorrhea or any of the STDs, they are also at risk of being infertile. The same way with women. So STDs is either with women or with men. So the possibility of you being infertile is also high. We have, with the women, we have something we call pelvic inflammatory disease. If you have that, you are also at risk of being infertile. Aside that, we have other conditions that can make either the man or the woman also being infertile.
I see. So it looks like whatever happens, since it has to do with penetration, it means that everything related to that particular place has to be healthy and well taken care of.
Sure. So far as if the tubes are very patent, you don't have problems with your tubes. There is no disease, there is no infection. The possibility of the sperm passing through is very easy. But if you have challenges with your organ, or let me say the tubes, which needs the sperm to pass through, then that becomes worrisome, or that becomes our challenge, where the men are not being able to either ejaculate or to produce the quality sperm that they need to produce to be able to fertilize the ovum. So these are some of the various things that can also help one way or the other are meant to be able to either get a woman pregnant.
Okay. That is great. It means that this thing is serious.
Sure.
Even more serious than we think.
Yeah.
And I don't know why, going back to even the psychological factors, I think that it is also time that people take it easy on people who are actually going through some of these things. Because the criticisms are too much.
Yeah.
Too much. They make women go through a lot more.
Too much stress.
Yes. And now that Mrs. Laura has actually educated us that it doesn't only have to do with women, and it has to do with men. Please, husbands, when your woman is not conceiving, it is not just about her. It can also be you.
Sure.
So please, Mrs. Laura has told us a lot, and we've spoken about a lot of things. So you also have to make sure that you are checking yourself. You are not just focusing on your woman, my wife all the time. Please check yourself as well. We have another message here, and it looks like today my personal network is not really networking, so I also quickly make sure I check that out so that I can read the messages as well. But now that we know that infertility can be cured, but it can be managed,
Sure.
Are there also any other pills that you can take in order to control that or even conceive?
Yeah, there are pills that they are being given by the specialist. So we have the Clomid. It can be given. And then we have something we call metformin. Metformin can help to manage people with ovarian cysts.
Okay.
Then we have gonadotrophins, which are also administered. So these are some of the few drugs I can mention that are being given that can also help to be able to manage or help you to be able to ovulate, or help you to be able to increase your sperm production or produce quality sperm.
Right. Okay, this one is coming from Bob Dope, and he's from Kasua. He says, I'm from Kasua. Bob Dope is my name. I like your program. Thank you for liking our program.
Thank you so much.
And we like the fact that you like it. And he's asking that if low sperm count can also be a cause of infertility. Yes. And on that note, please, our WhatsApp line is always active. Our Facebook comment section is for you, our cherished viewer. Make sure that you are telling us what's on your mind. If you have any questions at all, I will be delighted to read them to my guests to also help you understand some of these things very clearly. So please, the number is 0503-951006. Let me repeat that. 0503-951006. Please send in all the questions on your mind. Don't just sit home and be confused. We are here to help you. So please, that is why we bring in the guests. So let us know what's on your mind. Bring the questions. I'll be happy to read them so that we can help you understand whatever we are discussing, very clearly and also understandably. So please, back to
answer him, I would say that yes, low sperm count can be another cause. So like I said earlier, everything around the semen is a problem.
It's a problem.
Or a challenge to our men. So if you are producing the sperm, but the sperm count is low, can also make you infertile. Because we need some quantity of sperm to be able to fertilize the ovum. Now, it's only one sperm that fertilizes the ovum, but it comes with the quantity. And if the count is very low, the possibility of you being infertile is high. Okay. So that is why our men, we are encouraging you to eat healthy foods. Foods that are rich in vitamins, food that are rich in, vitamin C, citric fruits, and then food that are rich in zinc can also help to build your sperm and to be able to increase the sperm count. Aside that, if your sperm count is low, there are other drugs the gynecologists may give you which will help boost the production level of the sperm or the sperm count. And then it makes the sperm to either stronger to be able to fertilize the egg. So it could be that you are having good sperm count or enough sperm count, but the sperms are not strong enough to fertilize the egg. That can also be another challenge. So if you have the sperm with a shape aside the normal shape, you can have challenge with fertilization. And then if you have a sperm that is having a very short tail, it can also be a challenge, because if we are running and I have short tail, I cannot swim well in order to get to the egg. So all we are looking at is the motility of the sperm, how the sperm is able to move from the penis down to the uterus, let me say the endometrium. Then it travels to a chamber through the fallopian tube to a chamber where the fertilization occurs, and the ovum is being fertilized by the sperm.
Wow, that is a lot. Bob Dope, I hope that we've been able to answer your question, or Mrs. Laura has been able to give you a clear explanation to your question, because we are all learning here, right?
Sure.
And it's even good that he also asks about low sperm count.
Sure.
Then it means that, what about some of the other health conditions related to men, infertility in men?
So
aside this low sperm counts and all of that.
So those with STDs, like gonorrhea, if you've had it before, you can be prone to having problems with your sperm. And then those who don't have, we have men who have undescended testes. So normally around 37 weeks of pregnancy, we expect that the male child or the male fetus or the male child or neonate should have the testes descended. So if that one becomes a problem, if you have problems with undescended testes, so when you are born with undescended testes, you can have challenges with fertilization or making you fertile, because the testes have not descended. They are inside the place where it has to now descend, and around that area there are heat, so it destroys the sperms. When your testes don't descend to the scrotum, they are being destroyed. So already it's been destroyed. It hasn't descended to the scrotum where it has the normal temperature. That is why we see their scrotum hanging. God made it there so that it can have fresh air, can have so that the heat alone doesn't destroy the sperm.
That's why it's hanging.
That's why it's hanging.
I never knew. Now I think I get it. And with you, your profession, you being a midwifery officer, people working day in and day out, with your idea and your knowledge, and with what people who come into your facility tells you, do you think that people are really taking this infertility issue serious? And what are society also doing about it?
I think that with my facility, we have women working in with such challenges. So normally, people take it serious when pregnancy is not occurring, or mostly among the couples. So when it's among couples who are not getting or conceiving, they take it serious. But if somebody having a normal problems with ovulation, let's say around the 18 to 20 years, who is not married, they are the age categories who don't normally take such things as serious. But immediately you get pregnant and you get married and you are not getting pregnant, it becomes worrisome. So there are those mostly who come with such problems, and then I think they take it serious, because if you are not taking it serious, it's either you have to go for adoption or any other way to be able to have your child by you.
Okay, that's great. We have another message from Nanaya, and she says, please, I'm Nanaya from Kaswa. Please, I'm a new mom, and my menstruation stopped when my daughter was 5 months, and now we are 6 months. Okay, and now when we were 6 months, I went for family planning injection, and now we are 1 year, 2 months. My menstruation has stopped. My menstruation has not been coming. Please, should I go for abdominal scan or how? Please help me. It's urgent. Should I take it again?
Yeah, I think I'm okay with her question.
Okay.
With her, I would say that after delivery, normally it's either you are having your menses or you not have your menses, depending on something we call lactation amenorrhea. So as you breastfeed, you are not having menses. So it becomes like a family planning for the women. So after delivery, for that short period of time, I would say there is no problem. Now, after 6 months, you went for family planning. Now, this family planning is to prevent pregnancy from occurring. because you don't want to get pregnant. That is why you had the family planning done. I don't know which type she had, whether it's the 1 month injection, 3 months injection, whether Jadel, whether IUD done. And so far as you have something we call family planning, meaning that you don't want to get pregnant for yourself, and that is not infertility. And after the time she had her family planning done, I don't know whether she had it removed or whether she had it stopped. It's either you are taking the injection, you had it stopped. Now, when you get the injection, the hormones are in your system. So they are built up in your system. So it will take some period of time before you get fertile, or before fertilization will occur. Because sometimes some of these hormones are there to either suppress the production of the egg, or to either go there to block the cervix, like with the Jadel. It releases the hormones into your system. So it goes to block the cervix for the sperm not to be able to have easy way to penetrate. The same way we have the IUD also done. So it depends on which type she has taken, which I don't know. She didn't state it in her write-up. So I would say that she should just walk into any facility and have a testing done. There are so many ways they can manage it. We'll have to help you to monitor your menstrual cycle, to know whether your menstrual cycle is normal, within the normal range. After then, you are still not having your menses, or menstruation is not occurring, or pregnancy is not setting in. We have other ways to solve your problem. So our advice, she walks into any closest facility around her and have some of these things.
Mrs. Laura, she's saying that she has stopped taking the injection for 3 months now, but it's still happening. So what should she do?
So like I'm saying, the injection are hormones that are being released into your system. Now, if the hormones are being released into your system to stop pregnancy from occurring, now it will take some period of time for the hormones to be less in the system before pregnancy can also set in. So she should give herself some time. Because 3 months is just a short period. Some people can have as long as, let's say, 6 to 1 year after taking off the family planning method, or after the injection. So it varies. It depends on what you are doing. Some people can have the injection after, let's say, 3 months, they'll get pregnant. But it comes with the individual too, with their hormonal imbalances. So when the hormones are in the system, they are being released in the system for over a long period of time. They will need that long period of time to also come out of your system before fertilization can occur.
Okay, so I think we really need to take a critical look at this so we can help Nanaya.
Sure.
So I think what she's actually trying to say is that she said that she's a new mother. Her menstruation stopped when, my menstruation stopped when we were 6 months. 5 months, when I was 5 months. And when we were 6 months, I went for family planning injection.
5 months pregnant, or 5 months after delivery?
My menstruation stopped when my daughter was 5 months. So it means that 5 months after delivery.
Okay.
And she says that when we were 6 months, I went for the family planning injection. And now there's another message. Let me go back. And she says that, and now we are 1 year, 2 months. My menstruation has not been coming. Please, should I...
So how many times did she take the injection? Was it only once?
Okay, I think that one she would have to send that if it was just once or not. But she's saying that she went for it when the daughter was 6 months, and now they are 1 year. The daughter is 1 year and 2 months, and her menses is not coming. So if she should, she has sent it. She said, please, I have stopped taking the family planning injection, but still it's not coming.
So how many times did she take the family planning?
It's 3 months injection.
3 months
3 months injection.
Okay, so she took, now you have delivered. So after delivery, naturally we have something, like I said, the lactational amenorrhea. After that, 5 months, your menses didn't come.
Yes.
So it is normal around that stage. Now, after the 5th month, the 6th month, you went for family planning.
Right.
And the family planning is for 3 months. So 5th month, you went for it on the 6th month. So it will go to the 9th month, because you are protecting yourself for 3 months. Now, those injections, I told you, they are hormones that are released into the system. They are hormonal drugs that are given to you into your system so that you will not get pregnant. So we are already in the 9th month. So 9 months, now you have not gone for the injection anymore. Not going for the injection anymore does not mean the hormones are still not in your system.
Right.
Already you've built the hormones in your system. So it will take some time before these hormones will reduce their level in the system. Before the system will now regenerate itself and start producing the egg. So if it was the one that is to suppress the egg production, now it has been released out of the system. You took it for 3 months and taking it for 3 months does not mean exactly 3 months you are going to be fertile. So you have to wait for some period after the 3 months and be able to assess yourself well. Know if the menses is not coming. If it's not coming, rush to the facility and then let's see what we can do for you.
She sent another message. She's like, only twice. So it means she took it twice.
Yes, so meaning that we've already passed 1 year. So she took the first injection, which lasted for 3 months. So she was 9 months now. Now she took the next one. We took her way past 1 year. So you taking the first dose, the risk at you having the hormones produce more in your system is not that high. But taking the second dose, you've already taken first dose, second dose. Now you are building up. So the hormones are built up in the system. So it will take some time before some of those hormones are being released out of your system, before the fertilization can occur. Or let me say that the ovaries will produce the eggs. Because if it's not going to suppress the production, then now there can be production. Are you getting it?
Yes, please.
So it will take time, a gradual. She should give herself some time. So she should give herself, let me say, like about 6 months. After the 1 year, she should give herself like 6 months and see if the menses doesn't start. But if it's not starting, she should just come to a facility, a nearby facility, and we have some testing done on her, some screenings done on her, and know if she's fine or not.
Okay, and there's another message. It says, good morning, Shobiz. My name is Stylish from West Hills. I really enjoy your program every day, especially Evergreen. I love watching your smiles. Thank you. Please tell the midwife she's doing the most. Thank you.
Thank you so much.
Stylish.
Thank you, Stylish.
Okay. There's another message. It says, please, I went for HB and they said my blood is 9.0 GLD.
Yeah, grams per deciliter.
Oh, okay. Okay, it says, please, my medicine to increase my blood. Please, I went for HB and they said my blood is 9.0 GLD. Please, any medicine to increase my blood.
Oh, okay. With your HB of 9.0, I would say it's fine, but it needs to move up. As women, it should be, let's say, around 11, 12 upwards to, let's say, 15 thereabouts. So if you want to increase your blood, you can eat. I prefer the natural way. So eat more green leafy vegetables. Eat more green leafy vegetables like kontomire, like abedru, like cabbage, the green ones. Lettuce. You can have your cucumber, your lettuce. Eat more of them to build up your heme or your blood. Aside that, you can take iron 3 polymaltose. That increases the iron in the blood. So we can have Polyfar, we can have Eleron, we can have Heme App. There are so many out there. So you can get any of them and have it, or you can take any of these few ones that I've just mentioned. But I would prefer you build up your blood naturally by eating healthy, natural foods, which will help you. Aside that, you can be taking vitamin C, because vitamin C helps in the iron absorption.
Okay. Thank you so much, Mrs. Laura. And Nanaya, I hope that we've been able to be of good help to you. And please take it very, very serious so that you can equally take the leafy vegetables, and then it will also help your blood flow. And the best way to also be able to remember the medicine, since that is her main focus, maybe when we are done with the show, since it's live, you can't go back.
Sure.
So when we are done, you can go back and re-watch the video, you pause it, and then you take note of the medication, so that when you walk into any pharmacy, you'll be able to get that. Now, Miss Laura,
yes, ma'am.
Your final words.
My final words out there, I would say that infertility is a problem or a challenge for our couples. So if you realize you have challenges with either producing quality sperms, or with either having your ovulation, irregular ovulation, or irregular menses, or no production of egg, you have to rush to the hospital. There are so many things that makes one a little stressed up when it comes to infertility. So we should avoid stresses, especially our in-laws out there. We are pleading with you to have mercy upon our women, because sometimes it may not be the wife, it may be your son. So we should go ahead to have screenings done, have testing done, find out if I have challenge with fertilization, or I have challenge with ejaculation, or is it that my sperm is what is not fertilizing the woman's egg, or is it that the woman is not producing the quality egg that will get fertilized, or is it that my wife is stressed up, that is why she's not getting pregnant. Take her out, take a nap, take her out, go to the swimming pool, have regular exercise. You can go to the gym, do something different from the normal to make her a little relaxed to be able to get pregnant. Aside that, if you have challenges with fertilization or challenges with getting pregnant, just rush to a nearby hospital, see a gynecologist who are able to cater for some of these conditions. I have two great gynecologists in my facility. We have one, Dr. Antie and Dr. Mensah, which I believe they are also capable of attending to some of these challenges that most couples encounter. So if you have any challenge like that, just rush to the hospital. Aside that, if you still have more questions, for me, you can locate me at Mana Mission Hospital, the labor ward, or reach me on WhatsApp 0261 668390. So I think that is basically what I can say for our people out there. Don't wait till the challenge becomes trouble for you that you can't handle. It can be managed. So far as we have medications that can be given, we have surgeries that can be done, we have contraceptive replacement, or things that will help contraception to also occur. Whether we do the in vitro fertilization for you, we fertilize the egg, put it there, and you are pregnant. You have pregnancy throughout, and then you deliver your baby. So there are so many things that can help them out there. Don't wait till the problem which needs to be solved becomes a challenge for you, and then you end up stressing up yourself too much.
Okay, thank you so much for joining us, Mrs. Laura Ajoko Abubakari, a midwifery officer, and we are honored to have you here, always educating us. And today we discussed infertility in men and women, and Mrs. Laura has enlightened us about the ins and outs of infertility among men and also women. I hope that you have been educated and you took this serious, or as serious as you can possibly take any other thing, because this is something that we find common, something that worries a lot of people. So she has also given us her number. If you need help, you can equally reach out to her. Thank you so much. Thank you so much for always watching me and sticking and staying with me. I will be back with more.
I'm gonna do my part and make this a positive.